We are IPUMS Global Health. My name is Devin Christensen. I'm the project manager of a project called IPUMS PMA, and I'll let my colleagues introduce themselves before we get started.
I am Anna Bulgren. I am a project manager at IPUMS for a project called IPUMS Mix, and I'll be chatting about IPUMS Mix in just a little bit.
I'm Miriam King. I'm the project manager for IPUMS DHS, and I will be presenting on that in a few minutes.
And I'm Shula Sarkar. I work as a senior research scientist, and I work on the spatial and geographic data in all the three projects that we will be talking about, plus the census projects.
Great. Okay, so I'm going to get started with a brief introduction. So not sure how familiar everyone in the audience is with who we are at IPUMS. So we as an organization have been around for about 30 years. And so IPUMS, people often ask us, what does IPUMS stand for? But it's kind of more of a brand name at this point. Sorry. I meant to talk a few logistics before I launch into what is IPUMS actually. One second. So to give a little overview of our workshop today, I'll be giving the introduction. It'll be about 15 minutes. Then we'll proceed to the data collection descriptions that we have. So that'll be 4 data collections that we'll talk about today that have international data and data relevant to global health research. We'll take a short break and then we'll come back and do a web demonstration because all of our websites, the way you interact and get the data, you download it from our website for free. We'll take another break after that, and then we'll discuss in more detail geography, GIS tools, and our online tabulator. And then we have a lot of time for questions, and we will be monitoring the Q&A for questions throughout as well. So please feel free to type questions into the Q&A, and then if you put questions in the chat, there's a likelihood that we won't see it. So if you have questions for us about the content today, please be sure to use the Q&A, but we love seeing people engaging with each other in the chat. Okay, so back to where I started. So what is IPUMS? So what IPUMS stands for is Integrated Public Use Microdata Series, and the Public Use Microdata Series part of the name was what the US Census public use files were called, and that's where we got started with integrating data. So integrated means that variable names and codes are made consistent over time and place. And public use means that the data are already anonymized. Microdata is a form of individual level data, as in we have information about the characteristics of individual people as opposed to aggregate level data tables of entire populations. That might be divided into age or income level groups. So because we work to integrate data over time, users are able to pool data from different places and times in the same data set. So we are based at the University of Minnesota Twin Cities within an organization called the Institute of Social Research and Data Innovation. We are entirely grant funded, so access to our data is completely free. And I'll say that again, we never charge any money for access to our data. In addition to integrating data over time and place, we also conduct extensive research and documentation in a systematic and accessible way at the variable level. So at a recent count, across all projects, both US data and international, we had 2.5 billion microdata records and 2,500 data sets across microdata and aggregate data collections. And I forgot to update that slide. So if you go to our website, IPUMS.org, you'll be greeted with this panel of different data collections. So in addition to our US and international census samples, you'll find survey data on the labor force, health, time use, and other topics. We also have 2 aggregate data projects, which provide tables from US and international agriculture and population census data. So just for those who are maybe unfamiliar with what integration means, I'll demonstrate an example of what it might mean to integrate a variable. So this process applies for all IPUMS microdata projects. Each of the data collections you'll hear about today is an IPUMS microdata project. So the goal of integration is to make codes and variable names for the same information consistent across time and place. Having thorough documentation is essential for understanding how to analyze data comparability over time or across places. In particular, it's important to know your denominator, or the variable's universe, as we refer to it. For example, if you wanted to compare modern contraceptive use prevalence across time or between countries, you would want to know whether in one country or in one year, they asked the question about contraceptive use of women in unions only. But in other countries or times, they may have asked the question of all women, regardless of their marital status. So that first estimate would not be comparable to the rest because they're measuring the prevalence from a different population of women. And this is the type of information that we document as well. So I'm using an example from the data collection I work with, so IPUMS PMA. So in PMA, there's a question about the highest level of education that the woman attended. Because education systems vary across country, the categories reflect the country's schooling levels and have different codes. For clarity and help visualizing, I'm putting this into a table. And the codes on the left side are going to be the integrated values that you'll download from our website. I'll reorder the codes so that there are like categories in the same row, and also so that's increasing from less to more schooling. Okay. So then I will create harmonized labels to group the education levels appropriately. And I'm going to have a 3-digit coding scheme. So this is what we call composite coding. So we are going to put never attended all into one category because these are the same across these countries. And then we're also going to link primary up together. So the very first digit to the leftmost is going to have most general information, and it's going to include more detail as you go to the right. So we want to make sure that we are grouping comparable categories without losing any detail. So I'm also going to give larger categories codes to post-primary, secondary, and tertiary. You may notice that I skipped over 500, and that's because in other samples, we have a post-secondary, pre-tertiary group as well, but it's not part of this example. So then I'm going to add in more detail with the second digit code to divide up secondary level, because cycle 1 and 2 is different from A level. They're all within the secondary level of education, but we want to keep them separate just so users have the highest level of detail possible. But what you could do if you wanted to just generalize, what you could do is group by just the very first digit, and then you'd have comparably coded women at never attended primary, post-secondary, secondary, and tertiary, if you wanted to just group it into fewer categories. So the result of the integration process is that you can download one data set with women from each of these countries and years. all into the same file, where the rows represent individuals and the columns represent different variables. So this might be a survey identifier, household identifiers, and also like household level and individual level information like urban status or age. I want to emphasize again that the projects we're discussing today are not aggregate data. From our websites, you are not downloading tables grouped at the country or region levels. They are large files with individual records. We also have a dedicated user support team who you can email with questions if anything on our websites aren't clear. They can also answer questions about any data collection, or if they don't know the answer, they know who to ask. So I think we'll take a little bit of time now for the panelists to answer questions about the content we've covered so far. So make sure to type into the Q&A feature. Miriam, are there any questions in the Q&A that we should stop and answer?
Nothing so far. One thing I am going to mention is people may have some questions on how to access the data, like get permission and so on. And I'll just note that is going to be covered a little later in this.
Absolutely. Yeah, we do have a full 3 hours for the workshop, and but we'll have plenty of time at the end if there's something we haven't covered. Great. And with that, I'll hand it over to my colleague, Anna, and we'll begin discussing the data collections from in IPUMS Global Health and International.
All right, let me just switch around my screens here. Okay, so like Devin said, we're going to spend the next almost hour talking about each of the different data projects and give some details on the content and the different features. So I'm going to start by first talking about IPUMS Mix. And IPUMS Mix is a brand new project. It actually was just publicly launched earlier this month. And so I'm very, very excited to be talking about it today. IPUMS Mix is based on the multiple indicator cluster surveys, which are developed by UNICEF in the 1990s. And they are conducted in partnership with countries around the world since the 1990s. And these surveys share many similarities to other nationally representative large-scale surveys, that they are aimed at tracking women and children's well-being for creating indicators such as the Millennial Development Goals or the Sustainable Development Goals. And these surveys developed by UNICEF are generally pretty comparable across all countries. There's a big effort to make the data collected comparable. However, things change over time and countries have different needs. And so that is where IPUMS comes in. And IPUMS Mix is the fully harmonized and integrated dissemination system for the UNICEF Mix data. And IPUMS Mix has partnered with UNICEF to create the dissemination system. In IPUMS Mix, we currently have 88 countries and 202 samples with over 1,000 different data sets that are all harmonized together in over 900 variables. These are the countries that are included in IPUMS Mix, the 88 different countries. And most of these countries have nationally representative samples. However, some are only representative at a sub-national sample, which I'll go into a little bit more detail later. Many of these countries shown have multiple survey years, approximately 5 to 10 years apart. And there are a small number of countries on this map that are not fully visible, particularly those in the Pacific Islands and some of the other smaller island nations. Over time, there are different versions of the questionnaires and the data that UNICEF collects. And those are called by UNICEF rounds. Currently, data is being published for round 6, though UNICEF has just recently launched round 7. So the current data available is in purple on the side, and all of these different bars represent the data that we have available from IPUMS mix. Now, the different kinds of data available are all different. The different topics are represented on this table, and I'll go through this in a little bit of detail. At its core, a UNICEF mix sample is a household sample. There we go. So at the household level, there's information about different household characteristics, assets, housing conditions, water and sanitation, and water quality. And for each sampled household, a household roster is taken of all household members. These household members are found on a different data file, a different unit of analysis. The information about different household members includes basic demographics and education, along with a couple other specialty topics. The main focus of the UNICEF mix is the woman, particularly women of reproductive age. And women as a unit of analysis is available for all 202 samples, all back in time for all countries. The different data available on women are basic demographics, her fertility history, contraceptive and unmet need in maternal and newborn child health. And in addition, a data set specifically looking at all of the different births reported by women of reproductive age is available for most, though not all, samples. In many samples, particularly in more recent years, adult men in the household are also men are also surveyed, and men and women have information on mass media and information technology usage, sexual behavior, HIV/AIDS, domestic violence, and life satisfaction. But as I said, men are not available for all countries and all samples. Most often these are in more recent years. Another main feature of the UNICEF mix is the children 0 to 4. Children 0 to 4 is a unit of analysis found for every single sample, every single country. This data includes information on the child's basic demographics, child functioning and disability, early childhood education and development, anthropometry, illness, and child discipline. And finally, a really unique feature to UNICEF mix is the adolescent children, or the children 5 to 17 as a data set. These children are only found in those round 6 samples. So any samples 2017 on will have information on adolescents, and it includes basic demographics, a literacy and numeracy test answered by the adolescent kid themselves, parental involvement in the child's schooling, child discipline, and child labor. And I'm particularly excited about this data being available, as this is often an understudied population. And it's made possible to study adolescent kids and on a wide number of countries across many years using IPUMS mix. One thing that UNICEF makes happen is you can mix and match these different data sets to ask really complicated questions. So, for example, if I wanted to think about how does a father's involvement with child's early childhood development impact a mother's life satisfaction, I would want to use information from the woman, the children, and the men, all combined together to be able to answer this question. Another example, maybe a research question is, how does access to clean drinking water in the house or the home increase or decrease time that an adolescent might spend fetching water? And in order to answer this question, I would want to get information from the household characteristics and also on the adolescent. Right now, we have released all of the countries those 88 countries and 202 samples. And we are currently adding more variables into the harmonization. I will be demonstrating later on how to search and download the variables and samples available at IPUMS Mix. So hopefully that will make some of this a little bit more tangible later on. So I will now pass this over to Miriam King to describe IPUMS DHS. And while we pass it around, we can answer any questions that might have come up.
Anna, someone in the chat, Zenat, said, when you say 202 samples, what does that encompass? I feel like that might be better answered live than to type it out.
For sure. So we have 88 countries, but some of those countries have multiple years. So for example, we might Mongolia 2012 and Mongolia 2018. Those would be two different samples. And Mongolia actually has a really long, there's 5 or 6 different years available. So country year combinations is what I refer to as a sample.
Excellent. And then another one, they just came up from IPUMS Mix while we're here. It says, is IPUMS Mix geocoded? Go ahead.
Using IPUMS Mix data, you can identify first level geographies, usually a district or a region or a state, as we would call it in the US. Some countries have second level geographies, but the GPS points are currently not available. UNICEF is starting to make them a little bit more available, and this might be something that IPUMS Mix does in the future, but currently IPUMS Mix and UNICEF Mix are not geocoded or very rarely geocoded.
Great. And the last question is whether literacy is included for the adults.
Yes, basic literacy or a variable on literacy for men, the adult men and the adult women is available for most, if not all, countries.
Right, that's all.
Okay, I'm Miriam King, and I'm going to be talking about IPUMS DHS briefly. Probably many of you are familiar with the demographic and health surveys. You've analyzed the data yourself. You've read books and articles using DHS data. IPUMS DHS is designed to make those data easier to use, especially across time and space. So the demographic and health surveys have been fielded from the 1980s to the present. The DHS program website describes the data as collecting and disseminating accurate and representative data on population health, HIV, and nutrition. For those of you new to the DHS, the word health actually has many, many aspects covered by the DHS, such as domestic violence, child vaccinations, acute childhood illness, prenatal and postnatal care, health behaviors like smoking and alcohol consumption, access to health care, chronic diseases, fistula, just dozens and dozens of topics. So it's a very broad survey whose scope, it started with a fairly limited amount of data, especially on fertility, reproduction, family planning, use, fertility desires, and some basic child and women's health, and has just added topics over time. The DHS consists of over 400 surveys in more than 90 countries, and it has been for decades the leading source of information on health in low and middle income countries. So IPUMS DHS is basically a website with a lot of technology behind it that allows you to browse the variables available and create a customized data set that is suitable to your individual research projects. As you can see in my last bullet point there, We have created over 20,000 integrated variables using the IPUMS, the DHS source material. So the strength and the weakness of working with the DHS is it can be overwhelming that there's so much material on so many topics. And we have made it easy to see at a glance, as you'll see in the website demo, what material is available on in each survey, and to drill down and learn about variables in depth. To access the data, you need to register with the DHS program. They have the legal ownership of the data in agreement with participating countries. And so you have to go to their website to request access. There's a link to bring you to the request page for the DHS program on the IPUMS DHS website. It's pretty simple. You give some background information, you specify what samples and survey data you want, and provide a few sentences on what you want to look at to make sure that you're asking for something that can actually be answered using these data. But they want people to use the data. So if you hesitate to request data in the past, I encourage you to go ahead and do so. If you're already a DHS data user, you can use your DHS user ID and password to log into the IPUMS DHS website and start downloading data right away. Our main goal is to simplify studying change or conducting comparative analysis using DHS data. My co-PI, Dr. Elizabeth Boyle, has a history of studying the health and well-being of women and children, and she was so frustrated with trying to do, global multi-country research with DHS data that she came to IPUMS and said, can we make this easier? Can we IPUMize this? And that's what we've done. So we start with the DHS public use files, but recode the data to make it, again, the same variable name and the same variable codes across time and space without losing information using the composite coding method that Devin demonstrated. On the website, there's extensive information on each variable, and again, a really large amount of available material. Currently, we are focusing on standard, continuous, and interim DHS surveys with data available for 180 samples in 45 countries in sub-Saharan Africa, the Middle East, and South Asia. And we'll be doing another data release later this year that will add more data, especially for Africa, plus some additional South Asian data like the latest Bangladesh survey and the latest Indian survey. So some advantages using IPUMS DHS rather than using the original DHS files. It makes it easy to identify the topics and variables included in each sample rather than leafing through hundreds of pages of code books and taking notes. Gives consistent variable names and codes. Now, you may know that there are some standard variables already in the DHS data files. For example, women's age is always given the same variable name. But in working with the original source material, we found that about 80% of the data, of the variables included in the public use files from the DHS is not standard. Either it doesn't have standard variable names, or it has a standard name, but the codes aren't standard. For example, religion has the same variable name in all countries, but the codes, so for example, the response Muslim is not the same code even in the same country across time. And so we apply standard codes without losing information. For each variable, you have documentation on the variable's universe, the question wording in English. The survey forms from the DHS website are maybe in French or Arabic or Portuguese or Spanish, and we have an English version available as well as the original forms online. And we discuss comparability issues that you should be aware of in general, and also looking at a country across time. With so many variables, it can be really overwhelming to work with the original DHS data. Even the sort of less expensive version of Stata, for example, you can't even read in a whole file usually for the women with the original data file. But with IPUMS DHS, you can create a customized manageable data file with just the samples and variables you want in the format that you prefer, and we'll be demonstrating how to do that. There are also an advantage of some additional variables that we add, like contextual variables on the physical environment and climate, on economic and social factors like population density and the incidence of malaria, and on agriculture. And to create these contextual variables, we use the GPS sample cluster points, which indicate where a sample was drawn, but may be displaced up to 5 kilometers in urban areas and 10 kilometers in rural areas. And taking into account that displacement to protect respondent confidentiality, we draw a 5 or 10 kilometer buffer zone around sample points. Then we bring in non-DHS information that's indexed by geographic location or GPS location, such as the amount of rainfall that fell in a particular area in a particular month. And then we associate that non-DHS information with all survey members in a sample cluster. So if, for example, you want to see whether drought or high temperatures was related to child malnutrition or fetal loss or low birth weight or other factors, we have provided some contextual variables that will help you do that, even if you're not all that trained in working with climate data or geographic GPS data. For more information about the contextual variables, I would direct you to this article by Liz Boyle and I in Population and Environment, May 2020, where we talk about the data available, how we created the contextual variables, and how to use them. Another advantage of using the IPUMS DHS version of the data is we make it much easier to use the reproductive calendar data. For many, but not all samples, women of childbearing age were asked about the timing and dates of their pregnancies, births, pregnancy terminations, use of specific contraceptive methods, why they stopped using contraception, and in the period of 5 years before the survey. And if you want to analyze that data, choose woman months from the as your unit of analysis. Now, these data are available in the original DHS files, but they're very challenging to use in the original format. They come as string variables that have alphabetic codes for things such as contraceptive methods that are not consistent across time or countries. And we have made everything much, much easier to use. These data allow you to study things like contraceptive failure rates, early births, relationship between something like intimate partner violence or women's education or family wealth and the prevalence of miscarriage or use of contraception or use of abortion and so on. If you're interested in studying that, I'll refer you to an article by Liz Boyle, Nerotim, and I in Studies in Family Planning 2023. I want to backtrack a little bit here to say Anna did a great sort of introduction for IPUMS DHS in going over the units of analysis in IPUMS mix. There's a lot of similarity in terms of the units of analysis in IPUMS DHS. Except we do not have a separate file for children and adolescents above age 5. Sometimes you can get that information like on child labor or child discipline for children up to age 14 if you choose household members as the unit of analysis. But there's data for women of childbearing age for their births, for their children under 5, and for men for household members, and then for the reproductive calendar data, women months of exposure to contraceptive events. So there's already a lot of information in IPUMS DHS, but I'm happy to report that we received recently supplemental funding from NIH to allow us to include more information and data and guidance on studying the effects of climate change on health. We're working on adding material from 40 malaria monitoring surveys, or MIS surveys. These are shorter than the standard DHS surveys, but they include a lot of information specifically about malaria, such as the results of blood draws of children under 5 to see if the child has malarial parasites in their blood, information about malarial treatment during pregnancy for women, treatment of children, whether children under 5 had a fever in the last 2 weeks. If so, how is it treated? What medication did they take? How soon did they take it? How long did they take it? Where did they get it? Knowledge of things like symptoms of malaria and how to prevent malaria, exposure to anti-malarial campaigns, just a lot of in-depth information about malaria. We're also creating more contextual variables as part of this supplement and building a Launchpad website with guidance on how to do research on climate change effects and health. And I think that should be up in about 6 months. And I want to answer one question, which I saw in the chat before I started, which was whether or not we give guidance on analyzing DHS data. I would say up to a point. There are some user guides on how to do various things like work with the contraceptive calendar data. If you have a question, you can send it to our user support team and they will try to help, or reach out to me if they can't answer the question. But for some, our main mission is to make the integrated data available and well documented. And it's possible that I might, or the user support team might refer you to the users forum at the DHS program if that sort of falls more within their wheelhouse. So give it a shot, but we might refer you to the DHS program. Are there any questions that have come up about IPUMS DHS?
Yes, and you already almost partially answered one of them, that the same user asked about guidance with DHS analysis, is asking specifically about mortality computation, but it sounds like you've already pretty much answered.
Yeah, I would say for mortality computation, you should go to the publications and user forum for the DHS program.
Right. And then another one is, can you obtain subnational estimates of indicators using the DHS?
You can obtain subnational data for pretty much all the surveys. The closer you move toward the present, the more detailed the geography is. So if you look at some of the surveys from the 80s, they may just like divide the country into 4 pieces: the north, south, east, west. More commonly, there is regional data that is like US states, if you were to find a US parallel, or provinces. And for some countries, such as India, there's more detailed data on districts. And then there are the GPS cluster points. And as Shula will be talking about, there's both all of the country-specific or sample-specific geographic detail, and where there's more than one DHS survey for a country, wherever possible, Shula has created consistent geographic variables that have the same geographic footprint. Sometimes that means you have to combine some of the areas to get consistency over time, but that's another kind of unique feature to IPUMS DHS. Anything else?
Yes, someone asked, is there a DHS research group?
Not to my knowledge. I guess I could say a couple of things if you want to have a sense of like what has been published with DHS and IPUMS DHS. On the DHS website, you can search for journal articles using DHS data and keywords. There's also, there are hundreds of articles and conference papers and so on that have been used IPUMS DHS data. And if you go to the IPUMS website, there is a bibliography that you can search to see everything that's been published within IPUMS, using IPUMS DHS data that we know about. I know from having worked on articles using, describing things like the calendar data, that neither of those is exhaustive. So you might have to go to Google Scholar if you want to find other material, but those are good places to start in terms of finding examples of research on, topics of interest.
And then lastly, there was one person who typed in the chat, and I happened to catch it. They say that DHS has geo data. What was the logic on not including the geo data on IPUMS?
We have just negotiated with the DHS program to allow us to disseminate the geocoded data through the IPUMS DHS website. So that was another part of our supplemental funding, our funding supplement, something that we promised to deliver. The DHS program, they're great partners for us. And they agreed as part of our work under that supplement to allow us to disseminate the GPS data. They will still be reviewing applications to decide, oh, does this person really have a need for the GPS data for their research project? But you will, within a year, I would say, be able to include GPS cluster points as part of your IPUMS DHS sample. So thanks for that question, because I forgot to mention that. Anything else?
Nope, I think we're good.
Okay, so I am going to pass things along to Devin to talk about IPUMS PMA.
Great. All right. So back to me again. If you have questions while I'm presenting, feel free to enter it into the Q&A. We may not be able to see your question if you put it into the chat. We harmonize the Performance Monitoring for Action survey, which is a high frequency family planning and sexual and reproductive health survey that launched in 2013. It was designed to monitor progress towards FP 2020 goals and was funded by the Bill and Melinda Gates Foundation. The FP 2020 goals were to have 120 million more additional women using family planning by 2020, and that was established at the London Summit for Family Planning in 2012. And then IPUMS PMA is also funded by the Bill and Melinda Gates Foundation. So here are the participating countries: Burkina Faso, Cote d'Ivoire, the DRC, Ethiopia, India, Kenya, Niger, Nigeria, and Uganda. Indonesia and Ghana had participated but are no longer active in PMA. So as you can see, it's a smaller geographic extent than the other international microdata collections at IPUMS, but they have a lot of unique data that they collect. The sampling design for the female and household survey, so the core of PMA, are very similar to the sampling design of the DHS. So it's multi-stage stratified cluster sampling. They randomly select small geographic areas, typically enumeration areas from the country's census. They take about 200, the size of those are about 200 households. And of that around 200 households, they randomly select about 35. Those households are given a household survey, which includes a roster. And then the same interviewer will come another day and follow up and do a survey of all females in the household ages 15 to 49. And they also provide normalized survey weights with each sample. So just like IPUMS DHS and IPUMS Mix, you have a selection of units of analysis to choose from when you come to our website. And we integrate all the data available in IPUMS PMA. So the core is the household and female one. So it was originally designed as a cross-sectional survey where they sampled in the same like enumeration areas 4 years in a row, and they would refresh the enumeration areas. But it was different women. But they've now changed to a longitudinal and cross-section design, so that they're following up with women 3 different times 1 year apart. The household survey tends to collect some basic information, their wealth and possessions, water sources, sanitation. And then on the female level is the surveys can get quite long. They have a lot of data on fertility, family planning, and reproductive health, as well as other topics kind of like come in and out as needed. So those other topics include migration, gender-based violence, economic empowerment, menstrual hygiene, health insurance, abortion, contraceptive side effects, and a contraceptive calendar, very similar to the DHS's contraceptive calendar. So one of the innovative things that PMA does is that they collect data from service delivery points. So what they, and a service delivery point could be a pharmacy, a hospital, a clinic, and they interviewed around the same time and in the same geographic area. So you're getting a service context about the family planning services provided in the areas. And they select up to 3 public and 3 private service delivery points in those small areas. So they also collect data on whether there's stockouts of the service of family planning services, or also antenatal care provision, abortion provision, post-abortion care, and postnatal check-ins, as well as some information about whether there is electricity and water without any interruptions. Lots of information on those files. And one thing about PMA is that they are rapid, they are nimble. They really quickly put together a phone survey after the emergence of COVID-19 to react to the fears that COVID restrictions may be preventing women from accessing health care. So it was right after the longitudinal panel had begun. So they followed up these women by phone to ask them about their experiences with COVID restrictions, where they got information about COVID, how they trusted those sources, and whether it was impacting their ability to get both family planning and also bring their children in for check-ins. They also asked the women about social distancing measures and attitudes. In Ethiopia, PMA collects panels on maternal and newborn health. So currently there are 3 cohorts. Only 2 of them are currently released, but they start with pregnant women, and they follow up. The follow-up periods have changed over time, but they're generally up to about a year, and they have about 3 to 4 follow-ups post-birth. So they'll ask a lot of questions about the antenatal care the woman received during the pregnancy, and also the experience of delivery and any complications that happened during the pregnancy or delivery, as well as following up on whether the infant had any health issues, whether those issues were treated, and whether the infant was vaccinated and when. There's also client exit interviews, and these can be linked to that service delivery point facility data. And these are short interviews of family planning clients who exit the sampled health facilities. So they ask these women about, what method did they prefer when they went in? Is that the method that they received in their visit? They rated their quality of care that they received at that facility. And they also do follow-up interviews about 6 months later to see, are the women still using a method and why or why not? And lastly, PMA did field a few nutrition surveys in Burkina Faso and Kenya. So that was combined household and female survey with facilities. So they focused on children under 5, and they did collect some biomarkers. They focused a lot on household food security, antenatal nutrition, breastfeeding assistance. And then in the facility survey, they asked about the types of nutrition programs that were provided. As part of our grants, we also have the IPUMS PMA data analysis hub log. And this is where we have, our team publishes blogs that include, analyzing the PMA data or we describe a recent publication using the IPUMS PMA data. And then we provide step-by-step the R code that leads us to the analysis or to data visualizations. We have a wide variety of resources up there, a lot on geospatial, some with interactive dashboards using R, some really great stuff there. I wanted to highlight 2 excellent examples from the blog. So one of our postdocs used client exit interview data, which asked women about the transportation method that they used to get to the facility. She found that walking was the most common method, followed by motorized vehicle. And she analyzed whether areas of Uganda that experienced more conflict or violence affected where the woman went, whether she used the facility that was nearest to her residence or not. Another example is we had a series, I believe a 3-part series on using the longitudinal data. So we have lots of examples of alluvial plots and the R code used to achieve those on our website. So any questions in the chat?
I'm not seeing any questions right now.
Great. Okay.
So I guess you can pass it to Shula.
Excellent. Pass it off to Shula.
Thanks, Devin. Looks like I have some extra time. Let's share screen. So I am going to talk about the international census and survey microdata. It is different than the 3 projects that you heard about. It's mostly census data. So the bigger question here is, why are we talking about census data in this talk? So the first part, I'm going to talk a little bit about what the census and survey microdata is and what is unique to it. And then in the next part, I'm going to talk about why we are going to, how could you use leverage the census data along with the other data to use it for your research. So this is IPUMS International, as I said, census and survey data for social science and health research. The mission of the project is to collecting, distributing microdata from around the world and to preserve and document and harmonize the data. My colleagues talked about harmonization. So harmonization in census is not different from what it was in the other projects. It's just like making codes and labels similar and bringing everything into a common platform so that it is easier for researchers to use. I also wanted to acknowledge the National Statistical Offices who entrust their data to us, and they kind of trust us with their really precious microdata. Just a few images here in line with the mission of the project, where the first two are moldy tapes from Bangladesh that the projects help preserve. And then the bottom image is from Sudan, where again, the project helped in preserving dust that was collected in the microdata tapes in the older censuses. So preservation is one of the main goals. The features of the IPUMS International project is not very different from what you have heard. The two bolded parts, the harmonized geography, I'm going to talk a little bit more about them. My colleague is going to talk about the data extract system. And then, of course, I wanted to highlight the free access to researchers. So this map shows all the countries that we have data for. Anything in dark blue is we are disseminating the data. Lighter blue are the historical censuses, mostly complete count data. And green is we have a memorandum of understanding with the country, but we are not yet disseminating the data. We have data from 103 countries, close to 550 censuses and surveys, and more than 1 billion person records. Right now, we are working on these censuses. As you can see, a few of them are from the 2020 census round. So this will be coming out soon. Besides what my colleagues described, which is harmonization, documentation, I wanted to talk about the pointers that are unique to this project. Pointers are like locator variables that identify the person's mother, father, spouse, or whoever, anyone present in the household. So it's pointing. So from this figure here, the head is number 1, and the spouse, if you say the spouse's location, it is 1 and 2 here. So these calculated indicators are specifically good for family interrelationship studies when you are doing it for research. The commonly requested variables from the census and survey projects are some of the demographic variables, as you can predict, work and industry, education and literacy, dwelling income, although we don't have income for every country's, nativity and birth, then some of these calculated variables of what's your household size, age of the eldest child, family size, and some of the pointer variables that I talked about. So how is census data useful? Some people will usually say that, oh, census is so broad, the questions are so broad, it doesn't go into details. But there are many ways that you can use the census. Census has a lot of cases. The N is really, really huge. So how could you leverage the census data to use with other data? Here I'm listing some of the publications that were done with census data as well as other data. And then I'm going to show you how we overlap in terms of the spatial, like the countries that are covered. On the left, it's the IPUMS International Census data, and on the right, you have the Demographic and Health Survey. In IPUMS, as you can see, the countries overlap, and same for PMA and mixed. So what can you do with all this overlap is a lot. You also have like the number of census, the temporal extent. Like here for Indonesia, we have more than 8 censuses. So it is with the darkest color of blue in IPUMS International. And then you can also see the temporal like overlap and the number of surveys that are there for the mixed surveys. The same here for PMA and DHS. And I wanted to bring up this 1 billion plus number again to show the number of cases that you can use to compare the different surveys in conjunction with the census. So how, before I go into that, there are 2 other projects that are distributed by IPUMS. The IHGIS, that's an aggregate data project, and the time use survey, it does not have much health information, but these are international projects, and I just wanted to kind of show it in a map. So what can you do with all this data? So you have like geography at the national level, at the first administrative level of geography, which is like if you take US in context, it is at the state level. The second administrative level would be the county level, and then third or lower levels of geography. So I listed all the IPUMS projects here, which has any international focus. And then you can see that they can be compared, like there is a lot of data interoperability that could go on at different subnational levels and disaggregations, and you can combine different data sets together to get an answer to your research question. So just a little bit of a preview here. We'll talk a little more on the geography section later after the break. But here are percentage older adults who use a private healthcare facility in Mexico. And on the right is the questionnaire from the INEGI, the Mexico National Statistical Office. And this is the main question they asked. And from the census data, we could map this out for older adults. And so here are adults with private healthcare facility, and here are adults who use a social security system. And here is the questionnaire again. So you can see that the trends are kind of reversed in the 2 maps that I showed. But this is what you get with census data. You can identify a broad trend as to where you can focus your research on and what you're looking at. I have another example here from Vietnam. This is, of course, 2009 data. We have the 2019 data coming out, and we can make another visual representation once that is out. But here we are disaggregating by small population groups, like low-level geography in Vietnam for age 60-year-old, and any person who say that they have severe cognitive difficulty. This is according to the Washington group, where they say that they have difficulty remembering or remembering anything or doing anything. So you can get a broader trend of where the area, like your problem area is, or where you need to focus your funds on to work on, and then you could do in-depth research surveys or use other data sets to get into those areas and study about the people in there. Besides all of these, you can do the sustainable development goals, like you can do more than 30 plus of the indicators, and you can do 10 of the 17 goals from the census data. during COVID-19 research. During COVID-19, research was done using the census data, rather IPUMS international data. Here are some research papers that I highlighted. And again, the other highlighting thing is health research using census data as well as some other data and some of the topics published and the research done. That is all I have for now. We can talk in-depth geography when we are doing the later part of the presentation. But for now, are there any questions?
I'm not seeing any open questions right now, Shula.
I think it's time for a...
I was just going to say, I'll throw in a question, which is, what additional data will be coming out in IPUMS International later this year? Do you have, tell us more or less what the countries are? And
Yep, I did have a slide. So 1 minute, let me get back to sharing.
And we also have a question about whether there is data for Nepal in IPUMS International.
Yes, there is data for Nepal in IPUMS International. It's colored in blue. But yes, oops, we need to do that. So here are the coming soon countries. Yeah. So if there aren't any questions, should we break for 5 minutes?
I'm sorry, we have a question about a couple questions. One is health literacy level a variable in any of these databases? I'm not quite sure what is referred to in terms of health literacy. I can say that literacy is pretty much available for adults across the data sets. And in terms of health literacy, like, for example, there's a lot of information on knowledge of malaria prevention and symptoms, for example, in the MIS surveys. So I think on particular topics, there may be data like, I don't know, there's data on pregnancy complications, for example, in some surveys in the DHS, but I think it's going to be, quite topic specific. We have a question about whether IPUMS has biodiversity data or green infrastructure data.
Not in the census, but I am not sure if Devin or Anna want to add anything from Mix or PMA or DHS.
Right. Again, I guess there are some sort of like NDVI, like green space data in IPUMS. DHS is a contextual variable, and I think you could, if you know a data set that's GPS referenced, you could combine it with IPUMS DHS data. And if this would be new to you, you might be able to get some advice when the Climate and Health Launchpad comes up. But there's...
I can take the next question.
Okay.
Do different countries require users to be authorized for using their census data? The answer is you will have to get permission once, but someone is going to, so all these projects, Anna, did you have a slide on this, how registration is different for all the projects?
I'll briefly talk about it, but you might want to go into some details now.
Okay, so all the projects that we talked about have different approval methods. And I'm glad you asked this question. So I'll start with IPUMS International Census surveys. So since they are country microdata, a human being actually reads your application where you have to write down your research project, and they approve you. We don't approve if it's like for fun, like for money or something, but we have to have legitimate social science researchers. For I'll let my colleagues talk about each of their projects and how they approve, because this is like an interesting question and good for users to know.
Yeah, for IPUMS PMA, you don't have to have a registration directly with performance monitoring for action. You can just apply to use ours. You fill out a registration form, and basically, you just like IPUMS-I, you need to describe your intended use. And basically, what we're looking for is you are not allowed to use the data for a commercial purpose. So we have had some people try to use it to like how they can market family planning or like contraceptive like products to people, and that's not allowed. But like journal articles, education, there's sort of like personal interest or using it in classrooms, that's all great.
I'll just say in terms of DHS, do they require authorization for different countries? When you fill out your application form, you specify what samples and countries you're interested in. And then you get approved for those. If you come up with a new research project where you want to add a country or expand a research project, you can go back and request additional data. Anna, do you want to say anything about mix in terms of different countries?
Sure. So IPUMS mix registration goes through UNICEF. So if you have an account with UNICEF mix, it's the same password to log in and access the data through IPUMS mix. To get access to UNICEF mix, it's a one-time application. Again, you have to put in a short description of your interest or your research question. But unlike DHS, with UNICEF, you apply for access for all countries, all years, with no limitations on particular countries. So anything that's publicly available is a one-time application, and that is the same registration that you would use to log in to and access IPUMS mix.
Right. For DHS, you don't have to go back to request access when there's a new survey out. So for example, if you got approved to download data from India, once you got it approved, you don't have to like go back and say, oh, I want India 2019 now. But you do with DHS have to specify countries. You could basically say, in your initial application, kind of give me all the countries, all the surveys. I want to do, global analysis of trends in antenatal care or something like that, and just kind of cover it. But it's up to you. But you can go back and add countries as you need.
I can take the literacy question that's here. The question is, would literacy be literacy in the national official language or in any language, or are they differentiated? The answer could be different, like it could be official language, it could not. But what IPUMS does is documentation. So every variable that is there, like including literacy, will have a documentation tab, a description tab by it, and then it will tell you in general what the variable is, and then there is a comparability tab where you can get to compare with other countries and with the other censuses or samples within the country. So if in any particular year, it's the local language, like in India, there are so many different languages spoken. If literacy is the language, the local language, or literacy is Hindi, it would be there in the comparability tab. So it's kind of a yes, no question, depending on the country and on the census or survey that's being fielded.
And I just want to add for DHS, the respondent is given a card with a simple question like farming is hard work or children love their parents. And there is one possible response category of that the question couldn't be answered because the person was visually impaired or they didn't have a card in the language that the person was literate in, but that's really, really small numbers. So I think they try to equip their interviewers, if it's a multilingual country, with multiple, cards that they can give someone and not just a single language.
I think let's take a quick 5-minute break and come back at 2:25 Eastern time. So exactly 6 minutes from now, but about a 5-minute break. Please keep adding questions into the Q&A. We'll continue to write answers as the questions come in. We'll also have another opportunity to answer more questions live a little bit later on. But yeah, 5-minute break, everyone. And we will start turning our cameras back on in 5 minutes, and that's how you'll know we will be ready to start. So thanks, everyone. get started in just a minute. I hope everyone got some water, stretched their legs. Okay. I'm going to jump into the next section where, let me get my screens figured out. Here we go. Okay. Sorry about that. You'd think we didn't practice this morning, but we did. All right, there we go. Oh boy, I am so sorry about this. I am just Would one of my colleagues jump in and answer some questions while I fight with this? I am sorry about this.
I'm just going to note that I'm really pleased with the participation rate here. We have about 90 people through this, which is great. We're really happy to have reached so many people. And there's a question: will you be sharing this recording of the presentation slides afterwards? I see Devin is typing an answer, but I'll just say verbally, yes, we're planning to send a PDF of the slides to everybody who registered for this webinar, and CUGH will also be putting the webinar up on their YouTube page, and we will be putting it up on the IPUMS general help page under along with other webinars. So you can expect to get the slides sent to you soon.
Yes, thank you, Miriam. All right, I got it straightened out. So the next thing I will be doing right now is a web demonstration. But first, I wanted to discuss a little bit more about the 3 global health projects and the similarities and differences between them. And this has been touched on a little bit in the Q&A already. But in general, each of the 3 global health projects, and that's IPUMS Mix, IPUMS DHS, and IPUMS PMA, they do share many similarities because there's a lot of comparability between the global health surveys that they come from. Question wording across the 3 surveys is similar, and in some cases even identical. Typically, these surveys are used to create indicators, so the content of the topics and the way things are worded has a lot of similarities. A lot of the times the universes are similar. Women 15 to 49 is a common universe. Children 0 to 4 is a common universe. And the overall sample design is similar, though not identical, between the 3 projects. And this shares a lot of the comparability across how the surveys are structured. However, there are some differences between the 3 projects, and this is something that you would really want to consider when thinking about your particular research question or topic of interest. First off, the 3 different projects, PMA, DHS, and Mix, have different countries, and so if there's a particular country or a region that you're interested in, it might only be available in one but not the other surveys. The starting year is also different. DHS is a lot longer standing survey, starting in the 1980s. Mix is has data starting in the 2000s, and PMA is more recent. And the timing of the data collections, DHS and MICS are typically only collecting data in a given country every 5 or 10 years, where PMA is a much more high frequency, more recent data. So these are all things that you would want to consider when thinking about which of these 3 projects might be the best option for you and your particular research question. At a high level, the different topics that are available share similarities. Again, all of these different projects will have information on household members and women, particularly those women of reproductive age and children 0 to 4. 2 of the 3 projects have the calendar data, men, information on households, birth history, and female genital cutting and mutilation. However, some of the projects have very unique data, as I mentioned with MICS. The adolescent children is a really unique feature of IPUMS MICS and UNICEF MICS. And as Devin described, the PMA data has some really detailed information on the survey delivery points with the infant panel and the longitudinal. So all of these different topics are something to keep in mind when you're trying to decide where to start looking for data for a particular research project. As we've sort of alluded to, there's different registration processes for the different projects. Like we said, going straight to UNICEF for the DHS program for MICS and for DHS, for IPUMS MICS and IPUMS DHS is necessary. We talked about this a little bit already. And then the second thing I want to highlight is that creating data extracts and downloading the data is different between the projects. Today, I'm going to be highlighting a web demonstration with IPUMS MICS. And IPUMS MICS is incredibly unique compared to all other data projects in that we do not disseminate data. Instead, we disseminate data syntax and the original data that comes directly from UNICEF. So this is a very unique feature. If you've ever used IPUMS on any other project, this is very different. And this is due to the agreement that we have with UNICEF and the agreements that UNICEF has with partner countries. So because this is different, I'm going to first demonstrate IPUMS MICS, and then I will also briefly show the dissemination and extract system at PMA as an example of what all of the other projects look like, so that you would have an idea of the 2 different formats. Now, quickly, before I jump into the web demonstration, I just want to say that we are working to make these projects interoperable, but we advise pooling across the projects. There are similarities in universe and question wording and availability. However, you must look at the documentation in great detail to feel confident that the variable names, the coding structure, the universes, and the sample design are what you think they are. And so at this point, we do not recommend pooling information from IPUMS MICS and IPUMS DHS together, unless you are very confident and have looked at all of the documentation very thoroughly. So with that slight warning in mind, I'm going to once again negotiate screen sharing. Okay. So this is the website for IPUMS, ipums.org. And you can see, I'm gonna make it a little bit bigger. You can see all of the different data projects that are available from IPUMS. And today we're going to focus on the IPUMS Global Health projects. And so these have their own website with each of the 3 different projects. And I'm going to open the IPUMS MICS webpage. So welcome to the homepage of IPUMS MICS. All of the IPUMS projects have a general format that looks very similar to this. So once you've looked at one web homepage, you can kind of navigate around the different web pages for the different projects. The first thing I want to draw your attention to is this register option over here, or this register, create an account option over here, they lead to the same place. If you have not yet created a UNICEF account, you will first need to do that. And this is what the UNICEF registration form looks like. And registration could take within 3 business days. So you definitely would want to fill this out before you have anything time urgent or pressing, like a homework assignment or something like that. Again, IPUMS does not control the registration process. It must go through UNICEF. And so if you have any questions about the registration process, we would be happy to help facilitate, but we would definitely be pointing you towards UNICEF. Back to the home page. The other thing that I want to highlight on this page is these different documentation notes. We have a series of user guides that are intending to help users with the various aspects of this website, from registering for an account, browsing and selecting the data, downloading and unzipping the extract, and some overall tips on what users should know. In addition, we have some general pages about the samples, the questionnaires, and some other really key features that are unique to IPUMS Mix. But all projects will have a user guide or a user note of some capacity. So those user guides can be found on the sidebar here. Go back to the home page. Okay, so the next thing I'm going to demonstrate is browsing and selecting data. You can get to the data 3 different ways. The first way is over on this left side, underneath data, it says browse and select data. Up here at the top, you can select data, or in this giant purple box, you can also click get data. We want to make it really easy for you to figure out where to find the data. This is what the data browsing page looks like. One thing that you'll have to make a decision on before you start browsing is which of those units of analysis is right for your research question or your topic of interest. Today, I'm going to be demonstrating the children 0 to 4 data. And so by doing that, I'm going to click on children 0 to 4. And then you can see over here, I am browsing the children 0 to 4 unit of analysis. And this, you will not be able to sort of switch between units of analysis without losing your progress on one unit. So doing some exploration, figuring out what's available can be a really great way to see everything that's available before making download decisions. The first thing that I'm going to do is look for variables. And the best way to start doing that is by selecting these drop-down menus, and you can see all of the different topics available for the children 0 to 4. So I'm going to first demonstrate and look at these care of illness variables. And by clicking on that group, I can see all of the variables that have that we've categorized as being related to care of illness. Care of illness does relate to a UNICEF module or a group of variables, and we try to keep that pretty consistent. But in general, this would be a place to find information on different types of illness for the 0 to 4-year-olds. In this grid, you can see the different variable names and a short description of what each of the variables mean. You can also see here a long list of the different samples. Again, that's the country year combination for each of these different variables. If you see an X, that means that this particular variable, fever, is available for a particular country. And if you see a dot, that means that it's not available. I'm going to click on this variable cough, which is defined as the child had a cough in the last 2 weeks. And on this screen, the first tab I'm taken to says codes. And there's a table that has the codes and the labels for the integrated variables. So those are the codes that were on the left side of the image that Devin demonstrated in the education example earlier on. And you can see that each of these different countries has an X, which means that that particular code is available. And if you want to look at how many specific cases are available, you can get a brief look at the number of cases for each individual country or sample that would be available. So again, these are the number of kids 0 to 4 that have information about this variable called cough. If you want to learn more about a variable, you can click on this descriptions tab, and this would say something along what this variable is. In this case, cough indicates if the child had a cough in the last 2 weeks, so it's pretty straightforward. The next tab you might be interested in is comparability, and this variable is generally comparable across samples. I'll show an example next where this is not the case, and you would want to read the comparability section to learn more about the specifics of different samples or different countries that might impact your research goals. The next tab I'm going to show is universe, and this indicates which individuals or which records should be included in this answer. So in this case, all children 0 to 4 are expected to have an answer to this question if they completed the questionnaire. Availability just shows for which countries and which years this particular variable cough is available for. And this final tab shows a list of all of the countries for which there is questionnaire text for this particular variable. So this demonstrates exactly how a particular country in a given year asked each question. These forms have all been translated into English and formatted in a way that can be read on the website. But if you did want to go and look at a particular, an original form, this image tag right here will open up the original UNICEF provided questionnaire, and you can see that this form for Algeria is in the original French. Okay, so I have looked through all of these codes, all of these tabs. I have a really good understanding of what this variable cough means. I have decided that I want to download this variable and include it in my analysis. So there's a few ways I can do that, but there's a big button on the top that says add to cart. And just like online shopping, I'm going to add this variable to my cart, which is how I would then download the data. The next thing I'm going to do is select samples, because maybe I'm not interested in all of these different countries. I'm only interested in a few of these countries. So I'm going to click select samples, and you can do this in any order, depending on if you're exploring or if you know very specifically what you're interested in. But the select samples page, which looks really similar across all of the different projects, of course, it would have its countries and years that are unique to the project, but the selection page looks similar. There's a list of all of the countries and all of the different years. Now remember, UNICEF mix organizes in different rounds or different phases. And so if you were interested only in the most recent round, then you could select all from round 6, or you could select all from a given country, or you could select individual countries and years. So whatever you would be most interested in, I'm going to be interested in all of the round 6 samples. So I'm going to submit my sample selection. This is again kind of like adding this to your shopping cart. And now you can see that I have 48 samples, those round 6 samples, and 1 variable, cough. I'm going to go back and look at a few other, give examples of a few other variables. The next variable I'm going to give a demonstration for is found in early childhood education. And I'm going to demonstrate the variable CD read mom. The mother reads books to the child in the last 3 days. If you already know that this is a variable that you want in your analysis, you can click this little checkbox at the side that says that's under the add to cart column. And that's another way to add this variable into your cart. But of course, I would highly recommend that every variable that you want in your cart, you could click on to look through the different descriptions and comparability sections just to see all of the documentation available for that variable. So this variable, does the mother read books to the child in the last 3 days? I'm going to look at the description to see if there's any additional detail on what this variable could mean. As I said, some comparability sections might allow for more information. And in this particular variable, there's some pretty major shifts over time that might be really important if you're interested in using this variable across many years. So for example, the age range changes between rounds from 0 to 4, and then 3 to 4, and then 2 to 4. And so this definitely might impact what you're able to do in an analysis if you want to use this variable. And then there's additional details that suggest that step parents or foster parents can also be considered mothers, but that's only for round 6. So again, just giving a full picture of all of the different variation that might be found in this variable. Another important thing to look at is the universe tab. And you can see here that each of these different samples, Algeria 2018 includes only children 2 to 4. Algeria in 2019 is 0 to 4. And Belarus 2019 is 1 to 4. So again, these are important details that might impact what analyses you could or could not do based on what children have an answer to this question. And the last feature I want to demonstrate is the search feature. So if you aren't particularly sure what you're, where to find something in these drop-down menus, or you want to know something really, really specific, you can use this search feature. And I'm going to search for the word interview because I really want to make sure that I have the day and month of the interview in my analysis. And there's a couple different limitations that you can use with the search feature. But using the search feature, I want to make sure that I have the interview day and interview month added to my shopping cart. So now that I have selected the variables that I want, I now have 4 variables for those 48 samples. I'm going to view the cart. And this is a summary of all of the variables I have for this child 0 to 4 unit of analysis. You can see at the bottom, I have the day and the month, and that child read variable and the cough variable. You can also see that there's a number of pre-selected variables, and these are variables that come with every single extract, and they're typically variables that identify different samples, different years, household identifiers, or line numbers or person identifiers that can be used to then link this child 0 to 4 data set onto different units of analysis. We also automatically include the weights provided by UNICEF and the result variable, as these can be key to both analyses and determining universes. This is create data extract is kind of like the checkout button. Once you're happy with all of the variables and you don't want to add more, you can create a data extract. And this extract demonstrates what you will be getting in your download. I highly recommend describing your extract with what you have put into your cart, just because if you've made a lot of extracts, it can be really easy to forget exactly what you've put into all of them. And this is, I'm just going to say cough and mother read. Now, this will be one place that when I show the PMA page, the PMA extract request page, there will be more options. Like I said, for mix, there are very few options because of this data syntax limitation that I'm going to show in just a minute. So once I'm happy with everything here, I'm going to submit this extract. If you haven't, you can see I'm already logged in at this point, but if you haven't logged in, it will automatically require a login. And if you do not have a login, it will automatically require a registration. So at that point, you would be required to either register or log in before you would be able to proceed further. These are all of the different extracts that I have constructed. And you can see that this current one is processing. As an example, I'll show you one that I created this morning with these same variables. And in order to download the data, like I said, IPUMS mix cannot disseminate data. You are downloading the data specifically from UNICEF. And this screen is telling you that you are being redirected to a UNICEF web page to download your data. And this is the UNICEF web page where you would then download the data from UNICEF and have the syntax that accompanies that data. I'm going to show very briefly how to run this data syntax, particularly for users who aren't familiar with Stata or don't have access to Stata. This step could be a little bit daunting. This is a fairly major limitation of IPUMS mix, is that you must have access to Stata in order to run a data extract. We are working to expand this to other statistical softwares, but right now you must have Stata. Okay, so first off, I'm going to switch my screen to show what the download looks like. So when you download from UNICEF, you have a data file, a syntax file, and a do file. Do files are the syntax files that Stata runs. And now I'm going to share a portion of my screen. So this is Stata. And this is the do file that is downloaded in that folder that I just showed. And all you have to do is run the do file, which is a single click once you've opened the do file, and everything is running in the background. It's reading all of its data files, reading the syntax, and automatically harmonizing and integrating the data that you just downloaded from UNICEF. And what you are left with is a single data set with all of the variables that you've requested and all of the samples that you've requested. And from here, you can start doing your analysis. So here's that cough variable that I just downloaded. So I'm going to go back to I'm going to go back to Chrome. Okay, I'm gonna I am now showing a very brief example from PMA just to show the differences in those final steps. This is the PMA homepage. It looks incredibly similar to the IPUMS mix homepage. I'm going to select my data, and you can see that the extract looks very similar, except there are a few other options. So one thing you can do is you have an extract, and I've already registered for PMA, so that process has already been finished. But let me go back just one screen, and now I'm revising an extract. And you can see here that there's a few additional options that weren't available on IPUMS Mix, including things like the data format, the structure, and the estimated size and the sample members. And then also, I just want to point out that on this downloads page, instead of saying download from UNICEF, you can just download the data directly, along with syntax files for SPSS, SAS, Stata, and R, and code books. So it's a little bit different, but again, there are user guides and tutorial videos to help walk through this process. All of the other projects look like PMA does, like this one that I'm showing right now. Only Mix has that different system. So with that, I'm going to stop sharing finally and take a moment to ask if there are any questions about the web demonstration.
Yes. So there is a question from someone who is an R user, and I think you've sort of already answered this already, but basically, what's your advice to an R user?
If you are an R user, or a user of any other software, and you want to use Mix, you have to have access to Mix to run that original do file. But most of the statistical softwares nowadays can use the data from the other softwares. So as long as you can run a do file or have a colleague run the do file for you, or to talk to your university and or run a do file, then you can export that Stata data file and import that into R, or import that into SPSS, and then you can use whatever statistical software you're more comfortable with. The big limitation is you have to at least run that do file once. We cannot do that for you. We cannot provide modified data. It must come from UNICEF. It must be run by you. So it's a little bit of a limitation, and we hope to, in the next few years, expand to R and expand to SPSS, so that that is one less barrier to using this data.
And is there some documentation on the IPUMS Mix website covering that topic?
There is currently documentation on how to run the extract in Stata. We are still developing user tutorials and guides on how to then get that data into SPSS or R. As I said, this project is about a month old, so we're very rapidly creating new user guides and tutorials as quickly as we can, and we'd be happy to emphasize things that people have the most questions about. So that's a great idea, and we'll get right on that.
I also wanted to ask you myself if you would demo for the sample selection page, explain the purple bubbles.
Yeah.
Since people may, within IPUMS Mix or within Mix, some samples do not cover the entire population, but might cover like a very specific population, like people in a refugee camp or the Roma. And if you want to be comparable across multiple countries, you may want to limit it to nationally representative samples. So if you could talk about that, Anna.
Yeah, absolutely. So this is, again, that sample selection page for IPUMS Mix. And I'm going to scroll down and you can start seeing a lot of these little purple bubbles with the eyes. As Miriam said, that these little eyes tell you something additional about a particular sample. So this Ghana 2010B sample is Accra only. These two different Indonesia samples are only part of Indonesia. These different parts of Kenya are only parts of Kenya, and these are all identified by these big purple bubbles. Yes, basically, if you see a purple bubble, it might not be nationally representative, or it's not going to be nationally representative, and then you would want to make a decision on whether or not to include that sample in your analysis. If you were to click on any of these different hyperlinks here, it will take you to a page that will tell you a little bit more about that sample and whether or not that is a nationally representative sample. You can see here that this Kosovo sample is actually a subnational population of Roma. And that is, you can also see that here. So there's a lot of different tools to make sure that you're downloading what you mean to be downloading and whether or not something is a national sample or a subnational sample. I would highly recommend looking through all of the different things that you're selecting and not select this all samples unless you're really sure that you want everything.
Right. We have another question, which I'm going to read off. Using the cough example that we just saw, if I wanted to conduct an association between mother's age and child having a cough, how could I download both of these from the woman and child unit of analysis and make a single data set?
Ooh, okay. That's a great question because it is not that simple, but it can be simple. So I'm going to go back to the select data page, and I've already walked through how to select for the children 0 to 4. What you would want to do is identify mothers of children. And the way that you would do that is not necessarily, you would want to go through the household members file, because the household members will have information on who is each person's mother if they're in the household. You would also want, if a woman is in the household and she is the mother of a child, then you could download information about her age from the woman file by selecting the woman and then looking for demography, which would have information about the age of the woman, and select that. You do have to create different data sets for every single one of these units of analysis. So the children are separate from the woman, and you have to go through the process of selecting variables and selecting samples for each of those different units of analysis, because they are not linked to each other. You must do the linking on your own. Again, this has to do with the fact that we cannot change, modify, or disseminate the original UNICEF data, and the UNICEF data has them in 2 different files. We do, however, to go back to the MIX homepage, have a user guide on linking between the different units of analysis, and this user guide provides some example data code on which variables you would need to use to link between the different files. It does take a little bit of understanding on how the different files work together. And again, like I said before, we're attempting to create more resources for people to be able to better understand how things link together. But right now, this user note on linking between IPUMS mixed units of analysis has some really good detail on where to get started.
I would also just want to add that it is different for IPUMS DHS. We don't have the same limitation in terms of our agreement with the DHS program. We can, give you data recoded rather than just code. And for IPUMS DHS, we link the household member file, which has household characteristics, to women and men. And then we link the household and woman file to their children and their births. So with IPUMS DHS, basically like those units of analysis are already put together for you. It's just a difference in terms of our agreements with data providers. There was also a question which I want to throw Shula's way, which was asking about overlap across countries. And you had some very nice maps, Shula, in terms of showing like the geographic coverage in IPUMS International and the other data sets. Also for all of these, if you go to sample selection off the select data page, you can see, sort of at a glance, the drop down of the countries available. And yes, there's a lot of overlap, especially with IPUMS International and the other data. But for example, if you want a time series for something, you may be able to get an earlier data set for DHS and later data sets for mix. So yes, these are all meant to be as global as they can be, which means there's a lot of overlap. So Shula, if you would, if we could give Shula control to show her maps again.
Here, 1 minute.
I'm just going to give another for Anna. So do we have to use Stata to link the different units together, like the children and mothers file?
No, you do not. The user guide only has Stata examples right now. But again, after you've run the harmonization do file that creates a single data set of a given unit of analysis, you could export that into SPSS. So for example, you could run the do file for children, export the children into SPSS, run a do file for women, export the women into SPSS, and then do all of the linking into SPSS. Yeah, or whatever you're more comfortable with.
I think I showed some of the maps. If there are other questions about overlap, I'm happy to take that.
Yeah, the plan is to take another very quick 5-minute break and then come back, and Shula will talk more about the geography and the tabulator. So why don't we come back at 3:15 Eastern time, so exactly 5 minutes from now. And if you do have questions in the meantime, continue to put them into chat. Like we said at the beginning, at the end, we'll have time to go through all the questions that we didn't have time in these interim breaks. So 5 minutes, and then we'll come back for the last presentation section.
So we have come to almost the last section here before we go into questions. So do we have any questions that I can answer about the previous sections before we go into more details on spatial information and geography, and also a little bit more of the website demo, which is a different one. That's the online tabulator. So any other questions in the chat?
I don't see any. I think you're good to just jump in.
Okay, sounds good. So this section is about the geography and the spatial information in all the projects that we covered. So one of the, so here we are. And in our system. So how does IPUMS, like you saw, all these projects and the data sets can be gotten from other sources like IPUMS. Mix can be got from the mix, the demographic health surveys, and also the censuses from different national statistical offices. So what does IPUMS add to these? We covered most of these topics here. Integration and harmonization, of course, documentation, which was shown in the website demo, creating extracts, which was showed by Anna, family interrelationship and pointer variables. So I'm going to talk about the spatial harmonization and GIS. So boundaries change, like a unit administrative boundary changes from one census to another, from one survey to another. So if you are doing time series analysis, how do you deal with that? That is kind of the main topic here. So let's take a very simple map, and let's assume that in 1980, there are 3 units, A, B, and C. In 1991, A split to A1 and A2. So you're harmonized, like if you are going to do a time series analysis between 80 and 91, then you would want to have a common unit, a common spatial footprint across the 2 census years, and that would be A, combining the A1s and A2s to A, and then B and C. Now, these data, and that by these data, I specifically mean the census data, not the 3 surveys of PMA, mix, and DHS, but the census data. If they have very low population, then you combine it for here. Example, we mention a population, let's say 20,000 persons threshold. It could be any number as stipulated by the National Statistical Office. But we have very low population. You combine B and C with A, and that's your harmonized and regionalized municipio. So let's take that into the real world. Here's a map from China, and the green ones, the 2,000 provinces, are administrative level 1. The red, blue, and the white are the 3 census years. And if the boundaries were all the same, you would have only seen a single color or a single line. But the fact that you are seeing all the 3 colors means that there have been changes and shifts in boundaries. So how does that look at? So here we have 3 censuses from Tanzania in 1988, 2002, and 12. And you have 3 colors. as you can see all the three colors. So now I colored in the parts where there are changes. These 2 units changed. Here there was another change, and here there was another reorganization of unit. So this is from DHS, from the 1996 survey to the 2015 survey. Here are the 2 maps, and then here are the changes that we are looking at. So what would that look in a table if you line up all the names side by side? So here, Arusha is here. But then if we go back here, Arusha actually changed from Arusha to, there were 2 units, which were Arusha and Mayanara. And then at the bottom here, you have Mayanara, which did not exist in the first year, but was there in the last 2 years. These 2 were carved out from Arusha. So change is real, and we need to account for that. And to do that, we combine the unit into a combined unit where you have the similar spatial footprint across the years. So here we have Arusha and Mayanara combined together, and then based on the same color coding, you arrange and rearrange the units. So in the IPUMS International Census data, in 1988, you have 25 units, and in 2012, you have 30 units, but you have 23 harmonized units. And in IPUMS DHS, you have 22 units here. 2015, you have 30 units, which actually matches with 2012. And then if you harmonize it, you have 19 units. So what does that bring us to? You have a harmonized geography. So this is from Ghana, but you have a harmonized geography, which has 102 units. And then you have 2 years, the 2000 and 2010, which have a lot more units. So if you are only going to study a single sample, like let's say you only wanted to study 2010, you can use a sample-specific disaggregation and sample-specific geography. But if you want to do a time series, you might consider using the spatially harmonized geography. So the spatially harmonized geography is a feature that IPUMS provides to all the projects that were mentioned in this talk. And it's a value added. So here are the primary level of geography, the first administrative unit in the census data, and then we are combining that based on the different censuses and surveys, and the same for admin level 2. So now we talked a little bit about interoperability and how you could combine between the different projects, and how, and I believe there was a question as to how you could combine different projects. So our answer to that at the primary level of geography are the crosswalk codes. So here are, this is an example from Bangladesh in IPUMS International, that's the census data. In 2011, you have these codes. In DHS, in 94, you have these codes. And in IPUMS Mix in 2019, you have these codes. So we know what was created from what unit based on a map, and we create a common unit, which can, like the crosswalk code, which we right now at the present moment, we have that in IPUMS International and IPUMS DHS. We don't have that for Mix yet, but you have crosswalk codes where you use the similar coding to talk, to take like census data, which have a huge number of observations, use it with health data from DHS, use it with Mix. So you have a similar coding structure for all the projects. That is one way to do it at the first admin level of geography with the codes and the labels. The other way to do it is through the GPS coordinates. So here is an example from DHS. So we are saying, like, we are giving an example of how you could use it, the knowledge of malaria and prevention methods and its effect on older adults. So older adult population is from Census and malaria data is from DHS. So DHS provides GPS clusters, which are displaced by 2 kilometers for urban areas and up to 5 kilometers for rural areas. And then a few of the coordinates are displaced for 10 kilometers, which we are not displaying in this map. So anything in green is an urban coordinate. Anything in yellow is a rural coordinate, which is 5 kilometers. Anything in green is 2 kilometers. And then we overlay census boundaries from IPUMS International. And these are the codes for each of the level, second admin level units. So it means that a point which is located here has 100% probability of falling within this unit, but a point which falls here has a probability of, let's say, 50% in this unit and 50% in this unit. So let's go through one of these examples. So point 313, let's see, 5003. So if this coordinate 500 in unit 5003 has 100% probability of falling here. Again, in 5003, coordinate number 314, which in all likelihood is this one, has a 42% probability of falling in unit 5003, and the remainder is in 5005. That's the other counterpart of this, if it makes sense. So we can go through another one, 5004, which is this one. This coordinate has 100% probability, which is in all likelihood this coordinate. And then there is another coordinate which has a teeny bit probability of falling in here, which is this coordinate over here. And the other one is most likely this one. We can talk more if this did not make sense, but it's the probability of each coordinate falling within the selected second level unit. So with all the spatial harmonization, what did we achieve? Like, what can you do here with all this information? So here are all the 1980 censuses that we collected, that we have in the IPUMS International Collection. And we are going to look at seniors age 60 and above through the different census rounds. And then maybe you can decide if the world is aging or not aging. So this is the 1980 census round. This is 1990 census round. Note that not all countries are included in every census rounds. 2000 census round, and then 2010 census round. If we take a closer look at Latin America, this is the second admin level of geography. And again, you can go through the census rounds. So these analyses were possible only because the administrative boundaries are spatially harmonized. And that is a kind of something we provide for all the projects that have been mentioned here. So I'm going to pause for a little bit and see if there are any questions. That was a lot to go through in very little time before I move to the online tabulator.
There don't seem to be any questions quite yet, but I wonder if if we give it a few seconds. Well, looks like maybe we can move ahead and we'll get to those questions later.
Okay, I'll move to the online tabulator. That's the last part of the instruction that we are going to do, and then we could move to an intense round of question and answers. So, share screen. So throughout this presentation, we have talked about IPUMS.org. So I'd say if there is one thing you take home after our talk today, it's our website, IPUMS.org. It was demoed several times, and I'm going to start here. It brings you in to this page. So I'm going to go to IPUMS International and then go into analyze data online. So this is like, you can do basic tabulations. You can also do a lot of complicated things like compare means, correlations. I am not an expert in this in any way, but I can kind of give you a flavor as to what you could do with the tabulator. I use the tabulator as a good descriptive tool to see if I can, like, I have a research topic in mind, to see the number of cases, if it is worth working on the topic, because with microdata, you can slice and dice the data in so many ways and maybe land up with a very narrow sample, adults 60 and above, who are in nursing homes or who have some kind of cognitive difficulties, and your N is really narrow. So to look at the N, to see what you're dealing with. So this is one way to look at the data in the first round. I have to mention that you do need an account before you use the tabulator. At some point, it is going to ask you to log in. I hope I'm not logged in. No. So it will ask you to log in. So you can, like, you can see the variables and the descriptions, but to download the data, you need access. Same way, to use the online data analysis system, you do need access. This tabulator was created by statisticians at Berkeley, and it runs on our servers. And the data are optimized in the background to run fast tabulation. So what we are going to do is do some data exploration first. So here you see each of the samples in the collection and countries in the collection, and then each of the samples. If you scroll down a little bit, it becomes a little more interesting. You can analyze all the samples together in one go, and this is one that I'll be demoing. And then you can also do it continent-wise. So first we are going to, if you remember or have been here since the beginning, I demoed some maps of Mexico with healthcare coverage, and then we can look at the data a little bit. So I'm going to take Mexico 1960 to 2015. Oops, I was logged in. So I'm going to log out and try to tell you where the system asks you to log in. Okay, so as soon as you select that, that is where it will ask you to log in. So now that I have logged in, I have access to do all of this. So we selected Mexico 60 to 2010. So we are going to do a basic tabulation of sex. So we run the table. So this is for you to see how fast it runs and what you get with it. So here is a male-female distribution of all the samples in the collection. Nothing much to see here. So we are going to go back to this tab and do sex by year. So I know this is sex and I know this is year, but you might not. So how would you find this? So year is a technical variable. So you have all the variables listed here: demographic, technical, geography. So I'm going to put year. You can take it and slide it. And you have person weight or you have unweighted. So I'm going to leave the weights intact and then run the table again. So if you see, the main tab here stays, and then you get your tables one by one. So I'm going to keep all the tables here so that we see what we generated. So this is a much more decent sex ratio here. You see all the samples one by one because you selected year. So basic sex ratio. It gives you this color coding. Some of my colleagues don't like it, but you can keep it. A pretty, a graph, which is not very pretty, maybe or maybe not very informative, but you kind of get the message. So now we are going to get into a little more maybe interesting things. So instead of sex ratio, which is pretty stable in this part of the country, of the world, let's get into some urbanization by year. So that is under GEOG. So I'm going to take urban and slide it here. And run the table, leave the default weights. So as we are running, you can see how fast this is going. We have so many microdata censuses from Mexico. And although these are weighted totals, we should run an unweighted, and then you can see the N that we are dealing with. It's like huge. So if you look at this, I thought this was really interesting, where the rural population was high here, and then you see the urbanization and the change in here. So what we are going to do is add in another layer here. We are going to, I'm sorry, not control, but filter this by age. And we are only going to look at older adults. So age 60 by 100. And then I'm going to run the table again. And now this is even more interesting. You see that older adults were more concentrated in the rural areas. And then at some point, they are more concentrated more in the urban areas than in the rural areas, like pretty much a total flip-flop. So I'm going to go back and then have year over here, and then look at the healthcare facilities. That is under other person variables, type of healthcare facility used in Mexico. So we will look at healthcare facilities. We'll keep here, and then we'll filter it by age 60 to 100. And run the table. While this is running, and Okay, so let's look at this first before we look at the website. So here you have the type of healthcare facility, and we only have 3 years because this data is only available for 2000, 2010, and 15. So you don't have the 1960, and you see the healthcare facilities used. So I'm going to go back to the website here. Again, IPUMS.org. Select data. I am going to select my samples, just keep the Mexico samples, so I don't have a lot of other things, and look at other person. And here are my codes for the healthcare facilities. So here I have code 0 to 7, no healthcare facility, unknown, and NIU. And I am going to go back to here. My unknown is filtered out because I really don't need that for my analysis. And also my NIU is filtered out here. So now what if we want to look at the facilities by geographic region? So in my row, I am going to use the first admin level of geography for Mexico. In my column, I'm going to use the healthcare facility, but I really don't need this number 8 here. I only need till number 7. So what I am going to do is use recode. So I'm going to put a bracket here, R, which is for recode. I'm going to say 1 through 5. If you look over here, 1 through 5 is public, 6 is private, and 7 is other. So I just want 3 categories. I want 1 to 5, which I want to name public. Okay. I'm going to do 6 to 6, which is private. And then, oops, close bracket. I'm going to control for year so that it gives, and then filter it age, older age population. So with that, let's see what it produces. So here I have public, private, and other, my 3 codes categories that I wanted it on. And then here I have that by region. Now this is a lot of data flushing out. So a couple things here. You can download this as a CSV file. So you can separate statistics into multiple tables, combine into one table. I'm going to have separate. I am going to say Mexico health.csv and create a CSV file. So here it's ready to download. So if you download this, you have your CSV file with this table. A couple more other things that you could do. Instead of a column total, you could do a row total. You could take out your weighted N, and you could get rid of your color coding. You could change the charts to a grayscale or however you want to. I'm going to leave this intact. And then I am going to, for percent and confidence interval, I'm going to make this and have 3 places and run the table. You'll get a much cleaner table with the color coding off. As you can see. And then you have the row which add up to 100. The last thing I'm going to demo is the means tab. So as I said, you can do a correlation matrix, regression, logic models. There is good help on this. So all these question mark buttons will lead you to the help page. So feel free to use that. And again, in my opinion, I think this is more a exploratory tool. You would still need to download the data if you need the data. But I do hear of researchers who actually do a lot of statistics in the online data analysis tool. So let's move to the means tab. Here, I'm going to fill out the other columns and then get to the dependent one. My row is my geog variable, which is the first admin level of geography for Mexico. My column is year, or I could also drag this here. And then my filter is age 60 to 100 again. Here, I'm going to use the healthcare facility, but then I have to use a couple of recodes here. So I'm going to do a 0. The space 1 through 5, and I'm going to call that public. And I'm going to code 1, which is 6 through, oops. I literally need up till code 8, but I'm just going to put in 6 through 9. And then it would be other. There's the bracket. And run the table. Oops. Made some error here. Let's see if this sorts out. Nope. Okay. I had that copied elsewhere, so I'm going to just Let's run the table here. And here you have a comparison of means for all the 3 years for the first admin level of geography for Mexico. You are welcome to do that sample specific, like 2010, 2000, and use that particular year. You can create and download a CSV file, because as you can see, the result is getting too big here. And that is where I'm going to stop with the tabulator, because that is the max that I went with the tabulator to comparison of means. But yes, you can try the other programs here, and then work on do some exploration and analysis. So I'm going to stop sharing now and open up the floor for questions, either for me or any of my colleagues, about any research that you want to do and you want us to talk about, any topics you have in mind, and you were wondering if we have data for that. We are happy to answer questions.
It looks like we do have a question about whether it's possible to create maps using the SDA online tabulator.
Unfortunately, no, the SDA online tabulator does not let you create maps. But you can download the shapefiles for all the projects that we talked about. If you go to the CUGH and GIS page, you can download shapefiles and make your map for that data project.
I think maybe you already covered this, Shula, but maybe to repeat which data sets have the tabulator. Not all do. I think it's IPUMS International and IPUMS DHS have the tabulator in terms of the international data, and then many of the US microdata projects have the tabulator. I taught a summer public health course, like just a week-long course on using IPUMS health data to people who, some of whom had no experience doing data analysis or any knowledge of a statistical package, and had them use the tabulator to, test a hypothesis and write like a little paper on it. And they caught on really fast. So I do feel like if, I'm sure we have some instructors out there, and if you want to have your students have the experience of doing some, data analysis, even if they don't have experience using a statistical package, you really can have them do simple things like, make a descriptive table and look at, differences between groups or trend over time. I think that was really satisfying to people, and it does get past the barrier of like, oh, I can't have people do this because they haven't learned how to use, state or whatever yet. We did have a question earlier about, which is sort of a general question about whether any of these data sets have data on substance use disorder or substance use. IPUMS DHS has some data on alcohol and tobacco use. Is that in any other data sets?
Not in IPUMS PMA. No tobacco or alcohol use there.
Yeah, and then if you don't mind going to US data, IPUMS NHIS, National Health Interview Survey, has data on like street drug use and alcohol use and disability through something like substance use disorder. So it's not. So go ahead, Vanna. Sorry.
So IPUMS Mix has will soon have a really similar tobacco and alcohol set of questions that IPUMS, similar to what IPUMS DHS already has. Those will be released sometime in the early 2024.
So there is a question here. Am I correct that we need to register for each IPUMS database individually? I see Devin is typing up an answer, but do you want to give that verbally too, Devin?
Sure. Yeah. What I was typing in was that each of the projects it's a different pathway. So it is kind of a yes answer with a qualification that you have to register with Mix and DHS and use their login credentials in IPUMS Mix and IPUMS DHS respectively. And then for IPUMS International and IPUMS PMA, you do need to individually register an account with either of those because we have agreements with in-country partners that require us to review the intended use, and we have certain restrictions on who we can approve for use. So the exception is so that's for the international microdata collections, and for IPUMS CPS, USA, and I don't know which other ones are included. There's an automatic approval of those registrations, and you can use a common registration for those other IPUMS databases.
We have a couple of other questions that I'm going to talk about for DHS at least, and then others can say if there's information in the data sets that they manage. Do any of the data sets include language information, such as primary language of education, language spoken in the home? So IPUMS DHS recently added questions about the language that the interview is conducted in. And there may be some surveys that include questions about language sort of under the ethnicity tab, but I would say that's quite recent that DHS has started collecting that. Others?
Same for IPUMS PMA. They ask for the language that the interview is conducted in, and then separately, in more recent samples, ethnicity. But that's all.
It really depends on the particular sample for IPUMS Mix. For many samples, ethnicity is available. Language of the questionnaire and language of the interview, which could be different, are available for some, though not all. As these are very country-specific questions, they are not always included in IPUMS Mix right now, but we're working to expand the language variables and the ethnicity variables that we have to include all available samples over time.
The census does include language questionnaires, but not every country. Yeah, primary language spoken at home is one of the common questions that have been asked in the census.
And Devin?
Oh yeah, PMA is the same as DHS. It's language of interview.
Right, and often in DHS they also ask ethnicity, which is, may or may not be correlated with language. There's also a question about, are there any charts or maps available to analyze distance to healthcare facility? IPUMS DHS has some samples that actually ask how many kilometers it is, but not necessarily, it's just like, it's, 7 kilometers for my household. It's not a map.
Yeah, for IPUMS for IPUMS PMA, we do not have the GPS coordinates of the service delivery point facilities, unfortunately. But one way you might be able to get some measure of like nearness is, whether it's located in the same primary sampling area, the enumeration area. In a few of the survey types, for example, client exit interview, they ask the woman, are you going to the facility that's closest to your home? And then we also have some information about, like, if it's not a facility that's not located in her area, whether it's in a EA that services her area. So not exactly getting the distance.
I think it's hard for some distance things unless they like ask, how long did it take you to get water for your household or whatever, because there are, with any kind of survey, there are confidentiality concerns. And like we already talked about with the contextual variables for IPUMS DHS, that they sort of where a sample point is, but they want to respect respondent confidentiality, so they do some displacement. And something that like is displaced, maybe 5 kilometers, like 5 kilometers is kind of a long way to bring your kid for healthcare. So I think some issues in terms of how far are hard for them to supply the information. And often it's asked in terms of like, how long did it take you to get to somewhere instead. Okay, I'm not seeing any open questions at this point. But maybe we'll give people a little more time to add if they want to.
We are right at time, so if
Okay.
others have busy days ahead of them, we will be providing a link to the recording and all materials at some point in the future. So please, we'll stay on a little bit longer. Please send any last minute questions, but materials will be sent out too.